So we're going to change gears a bit and sort of cover the planetary aspects, and we have a nice panel covering a broad set of topics. It's obvious we can't cover every aspect of climate change. You got a good lesson on emergent pathogens. So I'm going to give a quick 5-minute sort of background. I want to start with, of course, the planet, right? Which one can argue is going to survive. Whether we're on it or not is maybe a different question. But the planet, as you know from your ecology, is really composed of components. So clearly the biosphere is significantly affecting the other spheres. Now they all affect each other, right? Volcanoes, the geosphere, hurricanes, weather. But of course it's the biosphere that's developed to the point where now we're stressing the entire system. And of course, these are all interconnected. So talk about modeling. Can you imagine all these possibilities? That's why we sort of compartmentalize our studies into just doing pathogens, just doing toxic waste sites, just doing wastewater. Now, of course, when you look at climate change, of course, the main driver, carbon dioxide increases, have a multitude of effects. You see here just a couple of the ones I'm listing. But of course, when you try to sort of draw this panel, and I don't expect you to fully understand this, but you go nuts, right? If you had a huge board and started connecting all these dots, you see how complicated any type of model would be. So each of us sort of focus on a different box, maybe even a different color box, and we are going to touch upon some of these. We're not going to talk much about air pollution effects today, but that may be for another time. Now, this was a great slide. Dr. Plow, I'm not sure you're still here. Thank you for showing it. But of course, it's a bigger slide. It's by George Luber from the Climate Change Director at CDC. Unfortunately, he was demoted or sort of moved out of that position. Very sad. But he came up with this diagram, and it's a freebie. It's just go to the CDC. And most people see a static image. And the beauty of this is that if you stop that circle at any point, stop it right there, carbon dioxide increases, increasing allergens, respiratory impacts. There are people just studying that component. And then if you stop rising temperatures, changes in disease, vector ecology, and this is what you learned earlier today. So it is a large interdisciplinary field of study, and there's room for everybody, from the climatologist to the ecologist to the plant scientist, all parts of this. Now, I'm a chemicals guy, I'm a soils guy, I'm a toxic waste fellow, so I am particularly interested in what happens sort of down here. What happens when temperatures go up, flooding goes up, weather changes, and how does that affect the mobilization of toxins? Specifically down here, what happens when an entire city gets flooded? Where does that sewage go? And we'll get a discussion on that. We have a talk on that. Angela Silverman, Professor Silverman, will talk about some of this. So it really is a complicated thing, but keep in mind the bottom line of this is, of course, the human disease. So you may not have thought of what happens when a tornado hits a village. What happens to the gas stations? Where's that liquid go? Right? Because we're all responding to the emergency. But after the emergency and the recovery and the cleanup, you have toxins left over. And they need to be studied and, of course, minimized. So looking at these drivers and how they move into exposure pathways, finally into disease. And that's sort of what we're going to cover in the next while. Now, before I introduce the speakers for the panel, this is a new sort of angle, a new paradigm sort of CDC, and one that I really prefer because it is all about resilience. We can't stop climate change, temperature, right? There's something called thermal inertia, right? The longest day of the year is June 21st, but August is the hottest month. Go figure. So what I'm saying is the CO2 in the atmosphere has already changed, and it will continue to have effects even if we stop today. So we have to be resilient, and that's the key, I think, in public health. And it's not just climate resilience, but also hospitals. Every single profession needs to be able to quickly change and accommodate and solve problems. It's not a stagnant system, right? We always hope that our professions are rather static, but we know quite differently. They're dynamic and they're changing, and we need to be ready for that change. Matter of fact, that's my mantra most of the time, is get ready for change. Next year something horrible is going to happen in New York. I have no idea what it is, but you know it's going to happen, and it probably is something in your life too. Don't be afraid of it, but be ready for it.